Abstract ID 08 is Gender-Specific Trends in Drug Use, an analysis of substance use patterns among young men and women in Sri Lanka. NDDN Veerasinghe from the Faculty of Humanities and Social Sciences, University of Sri Jayawardenepura.
Good morning, all of you. I am Veerasinghe and I am a temporary demonstrator at the Faculty of Humanities and Social Sciences, University of Sri Jayawardenepura. And today's my topic was research study was gender-specific trends in drug use and analysis of substance use patterns among young men and women in Sri Lanka. First, when we goes to background, in Sri Lanka has experienced a substantial rise in prevalent substance abuse in recent years. As you see, the prison statistics explores in 2023. The all convicted prisoners was 46,936. From them, narcotic drug offenders was 29,192. At the present age, it was 62.2%. As you see, there are a lot of in Sri Lanka. The narcotic offenders have increased with those years, and then when we the research on drug use has consistently demonstrated that males are more likely to engage in substance use than a woman on a global scale. And according to Sri Lankan context, the statistic demonstrated that males are more vulnerable with substance use. As when searching numerous researchers, there are so many findings. The men are more vulnerable than to women with using substance abuse. And according to survey by Vikramasinghe, drug use is becoming more common among adolescents in Sri Lanka. Particularly in urban areas, the research indicates that young males are more inclined to experience with substances such as alcohol, cannabis, cigarettes. As when previously mentioned, more vulnerable with alcohol, cigarettes, and they use first instance cigarettes and alcohol as use of substance abuse. Then considering the gender specific with narcotic drug offenders and convicted offenders, there are so many differences with convicted offenders and narcotic drug offenders. When I go to my research problem was how do gender specific factors influence the patterns, motivations and consequence of substance use among young men and women in Sri Lanka. The objective was the primary objective was to identify gender-specific patterns in drug use among young individuals in Sri Lanka. Those the types, frequency, context, and the patterns with how they using those drugs in with differential with male and female. Then other objectives are to examine the socio-cultural and economic factors and to analyze the psychological and behavioral motivations and to provide policy recommendations to addressing and what we can do for the after. We can't after they have rehabilitated, what we can do for their future. Then my methodology was, the study area was the Valikada prison complex. When I with this sampling, first I use KJ and Morgan scale sampling, because there are so many drug offenders in those Valikada prison complex. Then after that, through the purposive sampling method, I have chosen 40 male and female with between 20 male and 20 female. The data collection was primary source and secondary sources. Primary data was collection by with interviewing and group discussions and questionnaire. Then secondary data was used previously researchers and internet, etc. When we go to my findings, the demographic factors, the mostly ages with using substance with male between male and female, more with 25 and between 30 years old men and women are mostly use substance according to age, and the education levels more offenders less, they have education less than ordinary level. And after the family economic status, majority of have used substance abuse with their income, monthly income less than 20,000 and 50,000. Then when considering with types of drug use, most of them have used heroin after the cannabis. Then methamphetamine and others like tablets and other like hashish. Those are used, those substances have been used after they have been with their interviewing. They told they have used those substance with less than enough of money used the heroin. Then after first they used to heroin, after that addiction they have used to cannabis and others synthetic drugs. When considering their first instance, the majority of have been used with the by peer influences. So with according to by a friend or by a husband or by a boyfriend. Then after they have used their first instance with the curiosity, and from my sample there are 5 they have used first instance without consent. They thought they have used, they don't know, they didn't know they have so many, like intoxicated with their drinks, so they don't know they have done it, or they didn't know how they intoxicated. When discussion, according to study, both male and female exhibit difference in the acute and long-term effect of substance. Young men and women are more likely to use substances such as alcohol, cannabis and synthetic drugs. And young women tend to use substances like perception, medication and over-the-counter drugs. And men faces peer pleasure than female within the social acceptance and drug use in certain areas, such as their peer influences. They have to use the alcohol and other substance when because their friends use. So from this study, the finding was, the main finding was the men faces peer pressure than female with the social acceptance. And after my studies, there are recommendations. The gender sensitive program should be addressed the stigma faced by women and the normalization of drug use among men, and improved awareness campaigns like school awareness program and like the programs with community with the community engagement. And the last one is my recommend there was largely peer influence, because the peer influence is the most major thing with drug abuse. So when we have to treatment with that peer influence. For example, in Western countries, they have so short discussion with live experience peer influencers. So in Sri Lanka, if we can make that kind of programs, it will be a better action to the reduce the drug abuse. And thank you. And these are the references. Thank you.
Thank you very much, Mr. Veerasimhan. Very quick question. Do you have any idea how many of these people are repeat offenders? Did you?
Yes, when considering with this recidivism, there are nearly 20, as I remember, there are 28.2% they are recidivism with drug abuse. In Sri Lanka, most are recidivists for the drug abuse cases, 20%.
Yeah. So what I understood is that sometimes people keep coming in again. You know, they get released. We are not able to address the issue, and they repeatedly come in for the same
as
offense.
we know, there are rumors and there are context with the prison is a crime university. It is because someone who imprisonment with the, for example, for the some kind of cannabis, using cannabis, after they release with link between the heroin or other things. So there are, in my recommendation, I didn't hear about, but I recommend to, if we can separate with their crimes, this would be a better.
Okay, one quick question from me also. So you are very correctly saying that peer influence is a major determinant of use, and we already know it. But what do you suggest as a effective intervention to combat this peer influence at the time it operates? You know, when you get used to it, like in rehabilitation involving peers, you have missed the bus. You know, how do you prevent them from initiating because of peer influence?
I think it is up to the other community members, because if one who go into wrong side, we have to get in the right side. So if when considering as a group, one who to get alcohol or get substance use, other have to use. This is not a right thing. So we have to do awareness program to all. With for example, when we getting awareness program at the school children at the age of A-level students, they don't considering the cancers, those things. They told when I suffering from cancer, I will be suicide. But when after saying you will be ugly, you are important, so they afraid with that things. So we have to affect with the peer influence. We have to aware others with the community.
Okay, thank you. Any questions from the audience? Okay, that's two.
Actually, you have selected the resource person of that your research, the prisoners of the several prisons. According to that, I asked you two questions regarding that. Actually, what is the most risk pattern of that the intoxication that several drugs, and the more risk of that pattern of that your identification according to research? The first question of that. Second one is actually if they are prisoners, how they receiving that drugs illegally, because they are under supervision of the prison authority. How they receive drugs, that is the second question.
Inside the prison, there are so many things how they get drugs, because when we consider Valikada prison, it is I think we have gone there as a goal behind that. I didn't discriminate the community, but I think behind the wall there was some like a slums or things. So they passing through the wall, and sometimes prison officers also helps to, when we discussing with them. I didn't mention here because this is also government issue. So when we discussing with them, they also say that some prison officers also help to bring the drugs into the prison with their lunch or like that. Because in Valikara prison, most of us remand prison in female ward. They are when I doing this research, they have that day there was only 80 female convicted prison at the Valikara prison. 373 others are all the remand prisoners. So these are the matters using with in the prison complex.
That is the answer of your second question. What is the first one? Most risk pattern of that. They are utilizing the drugs. What is the realizing or understanding regarding according to your research?
I think before I said what risk patterns will be here like peer influence risk patterns with those are comes with risk patterns will be peer influencers, and the other thing is some have told me when considered with them what the first instant, then the patterns when I before mentioned that have used heroin as their first drugs, then after without their economic disabilities they have transferred with cannabis, because there are very different cannabis types like Kerala ganja and pure cannabis. So they have been jumped to that substance use without less than of their money. So the patterns will start with the heroin and others like methamphetamine, those things.
We'll quickly move to the next question.
This is not particularly related to your research, but since you are a practitioner, I have two quick questions. One is we saw some kind of analysis about Sri Lankan women. The number of drug addicts, especially alcohol addictions, numbers are getting increased. And second question is that the influence of the Tamil movies, the smoking, so it's kind of motivation factor for the youth people to get addicted for this one, especially like actor like Thalapathy Vijay smoking in a movie. It gives us some kind of different mentality. Even I like to see it, to tell you frankly.
Yeah, because it's depends on their age categories. When we in between like 15 and 10, we acting as heroes in Hollywood heroes like Avengers, like so many. But after that, we comes to the Hollywood movies. After with 18, the age of 18, between 18 and 25, we acting like Hollywood, like we are when we with not the drug use. When we consider in the familiar things is when we consider discussion, and someone is someone who looking face to face, we ask why you are looking for, and in films also someone is looking for the face to face, they also, so they are acting, they have influence with those, as you ask, I think they have some influence with cinematic cinemas. And other thing is when you ask cannabis and alcohol, I have one experience with those things. When I did the research with using the included cannabis included more than using by university students. When I doing this research, there is a one clue: the shopkeepers with Ayurvedic shopkeepers, they are given chit. It is small chit. That is, chit is the infection of their stomach, the cure, the more than the giving for the some kind of cure as some allergy or some kind, but there are not any allergies. They give that chit, jump from the legal constitution or legal actions. So they have influence with their not only the participation but also the delivery people, delivers also have used their tactics to some kind of tactics to supply their cannabis also.
Okay, we'll move to the next presentation. Thank you very much.